As you just saw, poor Harry is a victim of a failing healthcare system. He is in dire need of medical assistance, but has to bear the pain because of his unfortunate financial situation. On the other hand, Tyler was able to come in and immediately see the doctor. Although this might seem unreal and unfair, it is an accurate representation of the US healthcare system. 15% of the American population who are ineligible for Medicaid are uninsured. Even those who are insured aren't fully covered in all situations. Ideally, everyone would be able to receive fair coverage. However, to do this, we would need to develop a new system. The new system would have to be economically feasible and, most importantly, be available to all. The current healthcare system has a plan in place to reimburse private companies to encourage better healthcare in the community. Currently, the US government spends $3.5 trillion a year on healthcare. 33.4% of that money is going towards private sectors. In an ideal capitalist society, a trickle-down effect may help the poor, but that is not the case. Instead, money is pooling in the hands of the top 1%. This results in underfunded public facilities and a 15.5% uninsured population. Countries that have universal healthcare systems like Canada and the United Kingdom have shown to have longer average life expectancies than the US. People in the UK, for example, live on average almost 3 years longer than their American counterparts, according to a CNN report in 2016. The people in these countries also tend to live much healthier lives, with the rates of obesity, cancer related to smoking, and opioid addiction being significantly lower than those in the US. The CDC filed reports in 2016 that showed Americans did not receive as much preventive care as people in other countries, specifically Britain and France. According to the CDC's report, 18% of all Americans made a visit to the emergency room, and 80% of those people went because they did not have access to other medical services. This means most Americans go to the doctor only when it is an emergency, because they cannot afford the costs associated with going to a physician, and are lacking the preventive care that they need in order to maintain their health. A semi-universal healthcare system could provide a solution to this problem. By enabling people to see doctors when they start to feel sick, we can increase the health of the overall population. The plan is not to immediately transition into a system similar to universal healthcare, but rather slowly transition over a period of 4 to 6 years. The first step would be implementing a form of government-run clinics. This would reduce the number of hospital admissions, allowing doctors to specialize in different fields of medicine. If they wish to specialize in emergency medicine or long-term care, then they will stay in hospitals. But if they want to continue as a general practitioner or as a family physician, then they will transfer into the free clinic. The reduction of congestion in hospitals provides hospitals with a greater supply of resources and available staff, which allows for a reduction in prices and a further reduction in the stress of taxation. At this stage, more serious illnesses can fall into government clinics' hands. Long-term disabilities and cancer, as well as peripheral health issues such as dental and vision, are still under the domain of private insurers, which is what most Americans currently struggle to pay for under basic insurance covered through employers. Under this system, medical expenses will become more and more affordable. As the system progresses, we can decide to expand to more peripheral health issues.